So Russia says it's ready to approve the world's first ever coronavirus vaccine by next week. It will be first offered to frontline healthcare workers, but actually large-scale trials will only begin after the slated approval. That decision is raising widespread concerns that the safety of the vaccine might be compromised in an effort to be the first country in the world to get a vaccine approved. We are going to talk about that. Let's bring in Dr. Bob Lahita. Thank you so much for joining us. So Russia is saying that they have a vaccine that they're ready to use on their frontline medical workers. You know, it's not like we haven't heard misinformation or deceptive things coming out of Russia, but often that's just politics. And the medical communities and scientists, they often rise above the politics and they're able to work internationally to get something done. So I want to get your take on this. When you hear a vaccine by next week coming out of Russia, sorry, I'm stumbling through my words. I was going to say, can you take it seriously? Basically, that's the question.
Yeah, well, Anne-Marie, you've hit on a number of very sensitive issues here. First of all, Russia had very, very interesting commentary regarding them being first with Sputnik back in the old days, and now here they are with the first vaccine, and they made that comparison actually. The World Health Organization and the Russian Association of Clinical Research Organizations all protest this incredible departure from standard procedure. And you're right, you made the good point that healthcare and health decisions should be the same around the world. For God's sakes, that's the one thing that all of us in every society should agree on, our own personal health, because we are all the same when it comes down to our bodies, our physiology, our homeostasis, our cells. And so I don't know why you would go to phase 3 right off the bat, which I will read clinical trials where the vaccines are usually given to thousands of people to wait to see how many become infected. And then it's compared with volunteers who receive a placebo. And the trials then determine whether the vaccine protects. Now, we don't know if the Russians are doing that at all. They're apparently bypassing phase 3, or they're working with phase 3 and starting to immunize people at large, particularly healthcare workers. It's not a very good idea. They're about to go into phase 3. So I got this from the Gamalieva Institute of Microbiology and Epidemiology, which says, oh, we're just about to go into phase 3. So it's an unproven vaccine from that standpoint. So it's a crude violation, and I quote here from the Russian Association of Clinical Research Organizations, a crude violation of the very foundation of clinical research, Russian law, and universally accepted international norms. So that kind of gives you an idea of where the Russians are.
And it seems particularly risky to, in a way, basically include frontline healthcare workers in your phase 3 research, because that's sort of what they're doing, even if they're volunteering. I mean, these are people that are already putting themselves at risk, their lives at risk, but we really, really need them to stay healthy. We can't afford to add additional risks to frontline healthcare workers.
Right, you're absolutely correct. If all of a sudden people become cavalier about not wearing masks and PPE, personal protective equipment, while they're on the front lines taking care of people who are coughing and vomiting and with high fevers, and all of a sudden all of your healthcare workers are infected, you're in big trouble, because that's the only difference between a functioning intensive care unit and functioning hospital and chaos. So I think that this is or could be a major problem. And I'm very happy to see the World Health Organization and other organizations, the National Institutes of Health and the CDC, criticizing this rush. Not that we're not trying to go as fast as possible, but you've got to do the right steps. You just can't jump in and start immunizing people willy-nilly with no data, no evidence that the vaccine works.
Precisely. But so let's dig into this vaccine. What are the Russians saying about it? How is this working? Why do they feel that this is really going to be a success?
Well, I was, Anne Marie, I'm looking for the antigen. The antigen means it's the substance that's injected into you. Now, I would presume it could be a whole virus vaccine. There are several kinds of vaccines: viral vector, the messenger RNA, the molecular, the protein based, the genetic, et cetera. And I'm presuming this may be a whole virus vaccine, which I suppose is the easiest to produce. And this could be dangerous if, in fact, it is a whole virus vaccine. But I've been doing some research on this, and I can't find for the life of me what the true antigen is. And maybe it is available, but I just haven't seen the right literature.
Okay, that's pretty interesting. So let's just say, though, that the Russian vaccine turns out to be a winner. It's working really well. What does that mean for the rest of the world? What does that mean for the US? What does that mean for the UK? I presume if they're not following sort of classic, the classic process to get a vaccine to market in the UK and the US, we'd have to sort of do the work that the Russians aren't doing. So if there's a vaccine in Russia that works, how quickly would we even be able to see it in the US?
Well, the vaccine is going to be available to the entire world, and therein lies the rub. When you have several products, and we've known this in our history, several products that come from afar that are bogus, and I use that term specifically, that are bogus, that may or may not work, you're taking a big chance by getting that vaccine. We have at least four vaccines, which are ending phase 3 right now, legitimately with big pharma in the production with our government, and those vaccines will be available to the world as well. Those are the vaccines that I would trust. And those are the vaccines that I mentioned: the viral vector, the genetic, the whole virus, and the chemical particulate vaccines, which are going to be tested throughout phase 3 on something like 30,000 people. So the data will be pretty definitive. And you can be sure that when you get the vaccine that is from our approved systems, our approved epidemiologically regulated companies, that you're getting the real deal and not a bogus vaccine, which may or may not protect you.
Right. Well, that is good. Listen, Doctor, before I let you go, I want to ask you about a photo that was in David Begnaud's story that we ran right before you. And it's a photo that's gone viral. So even if people didn't see it in the story, they might have seen it online, of this crammed hallway filled with high school students as they're making their way to their class. No one's wearing a mask. I'm told that, they have 5 minutes to get to their class. So at the most, I guess they would have been, passing each other for several minutes, maximum 5 minutes. But I think, a lot of people saw that and just held their breath, particularly because we're hearing more and more stories about, coronavirus cases popping up in schools now that they're opening. I'm just wondering, as a doctor, when you saw that image, what did you think? Because the calls to keep these schools open sort of keep getting louder and louder from the White House.
Well, this is what we were afraid would happen. Now, I've been talking to you, Anne Marie, about K through 12 children having difficulty keeping masks on, like first and second graders. But these are high school kids, and they need to be mandated. I mean, it's not a voluntary thing. They should be told, you're going to wear a mask and you're going to be socially distanced. I think the child that took that photograph that was suspended unfairly, although she did break the school's regulation, but her First Amendment rights say that she can do that. She can take a photograph. None of those children were identified. And we are clearly seeing what we never want to see, and that's grouping, no social distancing, no masses. That's an incubator for viral infection. One case that's positive will go through that school like a wildfire, and that's what we want to prevent. We want them to mandate college students, high school students, and any K through 12 children that will continue to wear a mask and keep them socially distanced. I don't know how many times all of us have been saying this in the media, that if you don't do this, you're going to have these brush fires of COVID-19, which are going to be very, very severe, infecting not just the kids in the school, but their parents, their grandparents, and their relatives, and people that they come in contact with. And it's going to really make spikes appear all over the country. So that's an eye-opener. That picture is an eye-opener, and that student did really do the country a service.
You know what? I totally agree with you. Dr. Bob Lahita, thank you so much.
Thanks, Anne Marie.